Hi, and welcome to week 5. So this week we're going to be learning all about amalgam, including the characteristics of amalgam and how to place a class 1 and a class 5 amalgam restoration. Let's first start with the composition of amalgam. So amalgam is an alloy, which means it's made up of a combination of different metals. It does include mercury and at least one or more other metals as well. The mercury is added because it easily combines with the alloy and allows it to become a moldable consistency, so it can be shaped and packed fairly easily. Some metals that are typically included are silver, tin, copper, zinc, and sometimes palladium, indium, and selenium. Because silver is the main component, it is typically called a silver filling or a silver amalgam. Obviously by the color as well, it's a silver color. So here you can see the typical composition of amalgam. As you can see, silver is what makes up the majority of an amalgam fill-in. Copper sometimes can have a low copper amalgam or a high copper amalgam. So lower copper amalgam, it does decrease expansion, and then the higher copper, you get less of a marginal breakdown. There's also tin, which aids in combining the mercury with the alloy, the metals, and then zinc as well can help reduce brittleness and prevent oxidation. So continuing to talk about the characteristics of metal, the main characteristics are strength and setting time, which can be determined by one, the size and shape of the alloy particles, so how big those individual particles are, the ratio of mercury to alloy. So more mercury will change these characteristics and vice versa. And then also manipulation, such as how long you are mixing it, triturating it, and how hard you are packing it down into the filling. Different sizes and shapes of alloy particles. So there are two types. Number one is a lathe cut, where these shapes are precisely controlled to maintain a desired average particle size and distribution. It does require more mercury in order to achieve this shape. And then also the spherical cut. It is more rounded, it requires less mercury because these spherical alloy powder particles have a smaller surface area per volume. So as you can see in the pictures to the left there, number one, or the top one is the lathe cut, the bottom one is the spherical cut. You can see those more rounded shapes. So amalgams made from lathe cut powders or a mixture of lathe cut and spherical tend to resist condensation better than just amalgam made from only spherical powders. So as you can see in the picture there, that first picture, to the left is the lathe cut particles, the middle one is spherical, and then that last picture is a combination of them mixed together. So when they're mixed together, they tend to be a little bit more strong. Ratio of mercury to alloy. So working characteristics and setting time are both affected by the percentage of the mercury to the alloy in the filling. A higher percentage of mercury is easier to mix and has a slower set time, but it weakens the amalgam and makes it harder to polish it. Anything over 54% mercury is called mercury rich, and most amalgams do contain less than 54% so that they have that increased strength. Packaging. So amalgam can be packaged in two different ways. Number one is a dispenser. It accepts a vial of alloy pellets and a container of mercury, which then get mixed together. The container controls the size of the mercury droplets. And then number two is the pre-packaged, pre-portioned disposable capsules that get triturated and mixed together. These are what we're going to use in our lab classes, the number two, where they have these little capsules, we put them in the triturator, it shakes it all together for us. Pre-packaged capsules do have some advantages over that first separate dispenser system we just talked about. So number one is consistency. Obviously they're pre-packaged, so they have the right amount of ingredients needed to mix them together perfectly. Whereas if we're doing it by hand, sometimes that can be a little thrown off. Number two, it's faster. We don't have to mix things and do measurements and everything. It's already there. We just mix it together. And then number three, it is safer because less mercury is expelled during the mixing process. Next, trituration. So trituration is the vigorous mixing process by which mercury reacts with the alloy powder. So as you can see in this picture there to the right, that is our triturator. It can also be called an amalgamator. Always follow the manufacturer's directions when you are selecting what time you are going to be shaking the material for. Every product can have a different time to it, so please be sure that you're reading the instructions to make sure that you are selecting the correct time. I believe that the capsules that we use are about 10 seconds of trituration time. And be sure to check out the materials and resources folder this week to watch the videos that are associated with this PowerPoint. So when mixing amalgam, it is very important to select the right amount of time as referred to in the manufacturer's instructions. So if we are doing whatever is recommended in the instructions, you should end up with an amalgam that has a shiny appearance and it separates in one single mass from the capsule. So it'll come out of that capsule in a perfect little ball and be fairly shiny as well. If you're over triturating or over mixing it together, the amalgam is going to come out hot, and it will also be hard to remove from the capsule because it's a little bit soft and wet as well. And then if we don't mix it enough, the amalgam will come out dry and crumbly and very dull. So as you can see in the picture here, that alloy powder and that liquid mercury are what are in the capsules. When they're mixed together, they're combined. And then that next area, under triturated, very dry, dull. You can see it breaking apart even. In the middle, you have the properly triturated, so it's nice and shiny. It's one fluid little circle, looks pretty smooth as well. And then in that over triturated, the very last one, it just looks, kind of a little bit dull, but also just softer. Like it's not a perfect circle, just doesn't look normal. Manipulation. So again, following the manufacturer's instructions is so important. There are correct operator techniques and procedures that we need to use when we're placing amalgam fillings. The amalgam must be meticulously triturated, so following the manufacturer's instructions for how much time you need to triturate them for. And they also have to be properly condensed as well, so we need to make sure we're packing them into the filling properly. The operator and assistant should not handle amalgam with their bare fingers, and they need to maintain a dry field of operation to prevent any moisture contamination as well. So next we'll talk about dimensional change factors, which help to either decrease expansion or increase expansion. Number one is the mercury to alloy ratio. So the greater the percentage of mercury, the greater the expansion and lower the strength. So this is why we don't want as much mercury in our amalgam fillings. If you can remember from our previous slide, really less than 54% mercury is acceptable. We don't want it too high or else it's going to kind of weaken the amalgam filling. Number two, trituration time. So the longer the mixing time, the less it expands and has greater contraction. But if you can remember from a previous slide, we don't want to mix it too much because that can also affect the appearance of the amalgam as well. Number three, condensation. Increased pressure during placement is going to decrease the amount of expansion that is left. And then number four, contamination with moisture. So if there is any contamination, saliva that's getting into the filling, it will greatly increase the amount of expansion that is going to result. So what does the ideal amalgam look like? The ideal amalgam is one that undergoes a very slight expansion once it is placed. So you want it to expand a little bit. This is because it allows the filling to kind of fit tightly into the preparation, which will help minimize leakage, making sure that no saliva contamination can get into the tube. Amalgam strength. Fractures in amalgam can cause corrosion, recurrent decay, and even clinical failure. Fractures are more likely in the proximal area of a class 2 because the tensile strength of amalgam is only about 1/8 the compressive strength. So you are more likely to have breakage kind of in that interproximal area where you floss between an amalgam filling. The compressive strength of amalgam 20 minutes after placement is only 6% of the strength it will have by the end of 1 week. So again, amalgam fillings aren't going to be set fully right after placement. They do take time to reach their full strength, and it could be up to 1 week. Factors that decrease amalgam strength. So number one, under trituration. We just talked about that in a previous slide. If you can remember the picture of a the amalgam that was under triturated, it was very dry, crumbly, didn't stick together. It was just very almost like dirt, where it's just kind of there, not clumping together. This is because it produces a drier mix, because it lacks mercury, it also lacks cohesiveness, and it overall reduces the strength of the amalgam. Also, inadequate condensing force. So when we're actually packing the amalgam into the tooth preparation, we want to make sure that we're condensing it thoroughly. If we don't, it can cause voids, and it can also result in excess mercury that will help weaken the amalgam and leave it more susceptible to corrosion and tarnish. This is because when we're condensing and packing that amalgam into the tooth, some of the mercury is actually leaving the filling in vapors. It's being vaporized during the condensing process. So by not packing it down properly, you're going to have too much amalgam left in the filling, and that can lead to issues. So going into corrosion and tarnish. Amalgam restorations often tarnish and corrode in the mouth. Corrosion is the deterioration of a metal by reaction with its environment. It does have a positive though, because when something corrodes, it is going to help seal the restoration, which will reduce the micro leakage that's present, because if it's sealing it, saliva and things cannot get into the tooth preparation around the silver filling. The negatives though, it does lead to the release of mercury in the body. And then tarnishing, on the other hand, is the oxidation that affects the surface of the amalgam. It creates a dark, dull appearance of the amalgam. So this is more so just an appearance thing, whereas corrosion is actually affecting kind of like the shape of it instead of just how it looks. So creep and stress. Creep refers to the gradual deformation of a material over time under constant stress. The creep process can cause an amalgam restoration to extend out of the cavity preparation, which will then increase its susceptibility to marginal breakdown, leakage, and even failure. Higher copper amalgams have a much lower creep value. They're going to withstand this process a little bit more, whereas amalgams with lower copper levels, they are more susceptible to creep. Next we have galvanism or galvanic shock, which occurs when dissimilar metals are in the mouth and act like a battery, where they're conducting an electrical current, which can result in pain. This can happen when silver amalgam restorations rub against gold restorations. I have one silver filling in my mouth, and I've experienced it before when I was biting into something and it had a piece of aluminum foil stuck into it, and I didn't know until I bit into it, and I felt that shock against my silver filling. It does occur more frequently when the amalgam is newly placed versus if it's been there for a long time. So because mercury by itself is toxic, we must make sure that we are handling it properly and follow proper hygiene procedures when using it. So number 1, store mercury in unbreakable, tightly sealed containers. When we are in lab class, we're going to have our amalgam in a sealed container, and this is where it should stay unless we're using it. So we shouldn't put it in any drawers, cabinets, things like that. It needs to stay in that sealed container. Mix and transfer amalgams over smooth surfaces to facilitate recovery of spilled mercury or amalgam. So we want to make sure that we're mixing the amalgam on a smooth surface like a countertop or tray, something that can be cleaned up easily. We need to clean up any spilled mercury immediately. Don't let it sit there. Use tightly sealed capsules during amalgamation. So when we're actually mixing it, we want to make sure that the mercury isn't leaking out of the capsules. Don't touch directly any amalgam. So we're not using our bare hands. We want to make sure that we have gloves on, and we're avoiding picking up anything that's going to go directly on our skin. Salvage any amalgam scrap and store it underwater or in an amalgam disposal container. So in lab classes, we will have an amalgam container that we'll use, and all of our scrap amalgam is going to go into that. Work in well-ventilated areas, avoid heating the amalgam, use water spray and suction when we are grinding dental amalgams. So if the doctor is removing any amalgams, they should have the water on, and we should be suctioning up all of the debris. And then finally, we need to alert all personnel involved in handling mercury of the potential hazard of mercury vapors and the necessity for using good hygiene practices as well when handling amalgam. So let's go a little bit more in depth talking about amalgam restoration. So amalgam restorations have been used for many years, but they are starting to become more phased out since composite restorations are becoming so much more favorable. One, not only for aesthetics, ease of placement, just patient preference really, and the composites are becoming the standard of care. So amalgams were commonly used for direct permanent posterior restorations that could withstand the demands placed on it by oral fluids, occlusion, and thermal changes. That is starting to change though, as composites are becoming kind of standard now in the dental office. Some offices still place amalgams frequently, but it's very few and far between, and those offices will eventually get phased out to where pretty much no offices will place amalgams anymore. So advantages and disadvantages. Advantages, it's economical, doesn't cost a lot. Long-term clinical performance, they do tend to last a very long time. They're durable, can be manipulated easily, can be easily repaired or replaced, require less placement time than composites, but they do have some disadvantages as well. So poor aesthetic qualities, they don't look the best. No one really wants a big blob of silver in their mouth. Mercury toxicity is a major concern to a lot of our patients. It does corrode over time. Some people could have possible allergies to the amalgam as well. Marginal breakdown. So over time, it does start to break away from the preparation, and that could cause micro leakage of saliva and contamination, which could cause recurrence. Indications and contraindications for using amalgam. So indications would be for class 1 and class 2 cavities. Restorations that have heavy occlusal contacts, restorations that cannot be well isolated, where aesthetics are not highly important to the patient, teeth that serve as an abutment for a removable partial denture. Now, contraindications for using amalgam include anterior teeth where aesthetics are a prime concern, aesthetically prominent areas of posterior teeth, small to moderate class 1 and class 2 restorations that can be well isolated, and then if the patient has a history of mercury allergy or an allergy to any of the components inside the amalgam. Next, we'll talk about the armamentarium, or the basics for what we use during an amalgam restoration placement. Number one is the basic setup, so the mirror, the explorer, and cotton forceps. Then we need some form of isolation, so rubber dam or cotton rolls, triangles, things like that. Number three, an amalgam well. This is the container that we place the mixed amalgam into. And then we need an amalgam carrier as well. That is going to allow us to carry that amalgam from the well into the tooth preparation. We need amalgam condensers of various sizes and some burnishers as well to smooth out the amalgam. Next, we need some carvers to carve some anatomy into the amalgam, articulating paper to check bite. So let's get into the instruments a little bit more. So the amalgam well, as you can see here, the bowl-shaped container is used to hold amalgam prior to it being loaded into the amalgam carrier. Then that amalgam carrier is used to pick up, transport, and pack the amalgam into the preparation. They do make single or double-sided ones, and they have various sizes from small to large. Next, we have the amalgam condensers. They can also be called amalgam pluggers. They are used to pack amalgam and composite into cavity preparation. So we're using this to pack it down into that tooth prep. Then we have burnishers, which are used for polishing, contouring, condensing, carving, and sculpting amalgam restorations. They do come in various shapes, such as ball-shaped, egg-shaped, acorn-shaped, beaver tail, and football shapes. Next, we have carvers. So carvers are used to remove excess material and also carve anatomical features. There is a Hollenbeck carver and a discoid cleoid carver as well. Just a side note, discoid cleoids are designed to pull rather than push material. It helps to shave the amalgam more effectively while it is being pulled rather than pushing it. So next we'll talk about mixing, placing, and condensing amalgam restorations. So first we want to triturate the amalgam based on the manufacturer's directions and then place that amalgam into the amalgam well. We're going to then fill the amalgam carrier and begin to fill the cavity preparation with a small amount of amalgam. We don't want to overload it to start. We'll firmly push against the tooth surface and eject just enough amalgam to partially fill the cavity preparation. Next, we will condense the amalgam to eliminate any voids and promote adaptation to the walls and margins of the cavity prep. We want to make sure we are placing at least 2 increments of amalgam in small increments. That way we're not overloading the filling and creating voids or poor condensation. Amalgam is sufficiently condensed when a condensing stroke leaves no more than a slightly noticeable mark, and then we'll place the final increment to overfill the cavity preparation to ensure that all the margins are covered. You don't want to underfill the preparation because then you're going to not be left with an adequate amount of filling material. We want to make sure it's at least a little bit overfilled, that way we can shape it back then. Carving principles. So the purpose of carving is to remove excess amalgam beyond the margins and to contour the restoration so it looks like a natural tooth. This carving also helps to remove the mercury-rich outer layer of the filling. Amalgam is ready to carve when some resistance is felt with the carver. The tooth surface will serve as a guide for carving. We want to follow the anatomy that's already there with the tooth. And if the restoration is under contoured, the amalgam must be removed and then replaced. If it's over contoured, it can be adjusted with a burr at a later date. So carving procedures. Number 1, recall the original outline of the preparation. Always take note of what the tooth looked like before it was prepped so you can try to mimic its natural appearance. Number 2, hold the carver in a modified pen grasp with the tip of the carver on the tooth surface and the heel end off. So as you can see in the picture to the side there, that tip is going to be touching the amalgam, but the upper end of the blade of the instrument is going to be up in the air a little bit, so it's not fully contacting the amalgam filling. Number 3, use the surrounding surface as a guide when carving. Remove excess amalgam, exposing the outline of the cavity preparation. Continuing, so part 4, we're going to place the carver blade at the gingival extent of the mesial margin with the heel on the tooth surface and the tip off. Move occlusally along the margin, removing excess amalgam, but avoid removing amalgam inside of the margin. We'll then repeat the step for the distal margin. Remove excess amalgam outside the margins of the cavity preparation. And again, if the restoration is undercarved, the result may be an over-contoured restoration with excess amalgam over the margins. We don't want that. But if the restoration is over-carved, then we're going to have an under-contoured restoration, and it will ultimately need replaced entirely. You can't just add more amalgam back on top to make sure that it is properly contoured. Like you can with a composite, you can add more material on. With an amalgam, you can't, so the whole filling would have to be redone. Number 7, recreate the groove in the restoration by resting the carver occlusal to and slightly distal to the occlusal margin with the heel on the tooth surface and tip off. Number 8, move the blade mesially to carve the occlusal margin, including the buccal groove on the tooth. Number 9, examine the margins and anatomy. Ensure there is no flash beyond the margins of the preparation. Do not overcarve the restoration or it will need removed and replaced. And again, amalgam cannot be added because it will not bond to that underlying layer of amalgam. So that's why it's really important to overfill the prep and then just take slightly away. You never want to underfill an amalgam. And then we're going to lightly burnish over the surface of the amalgam to smooth it so that it has a little bit of a dull luster to it. So let's get into the placement of a class 1 amalgam. First, we're going to examine the prep and remember the size, shape, and depth of the prep. We're going to clean the cavity prep with water and dry with air. If indicated, place a varnish, liner, or base layer at this time. We are going to mix the amalgam according to manufacturer's directions and deposit it into an amalgam well. We're going to pick up the amalgam in a carrier and dispense half of the load along the pulpal floor. As the amalgam is extruded, push the carrier against the pulpal floor to press the particles together. We're going to then condense the amalgam forcefully. You may have to support the patient's mandible with your free hand while condensing to ensure that you are pushing hard enough. And then also make sure that you're condensing in overlapping movements so that you ensure that everything is thoroughly condensed. Next, we will spread the second increment of amalgam along the pulpal floor, condense against the pulpal floor and internal walls of the preparation. We're going to continue adding amalgam and condensing each increment until it is level with the cavo surface. We'll then spread the final increment to adapt it slightly beyond the cavo surface of the prep. Next, we'll burnish the amalgam to ensure good adaptation at the margins and to initiate the contours of the restoration. So there is a video here that is also linked under the materials and resources folder for this week. Please watch it because me just explaining the steps, very confusing. Actually watching it is a whole nother thing, especially before your lab class Saturday. That way that you can see how it should be done before actually hands-on doing it. And again, please watch this video in the materials and resources. So next, let's talk about what to do if the lingual or buccal aspect is involved in a class 1 restoration. So, in order for the amalgam to be confined when condensing the buccal or lingual area, we have to place a matrix band around the tooth to act as a temporary wall. Now, a single matrix band alone is going to adapt poorly to this buccal or lingual area due to the shape of the tooth. It'll create a little gap there. So we have to place a secondary matrix strip as well between the tooth and the first matrix in order to compensate for that extra space. So as you can see in the picture here, they have the Toffelmeyer going around, and then they also have another smaller section of band that is wedged in there with a wooden wedge. We're going to start by condensing the amalgam into the most inaccessible area of either the lingual or buccal side. We will continue adding increments and condensing as well. And then remove excess amalgam next to the matrix band before we actually remove the matrix band. So, criteria for a finished class 1 amalgam. The amalgam should be smooth with no detectable pits or voids. The amalgam should have a dull luster to it. The anatomical form is continuous with the surrounding tooth structure. No open margins are present. No submarginal areas that cannot be smoothed during finishing and polishing are present. The amalgam does not extend beyond the cavo surface margin of the restoration. The restoration should contact the opposing tooth simultaneously with the unenveloped tooth. No premature contact should be there. The restoration is not out of occlusion though, so we don't want any premature contact, but we also don't want it to be completely out of occlusion. And then the patient should report that their occlusion feels good. Next, we'll talk about the placement of a class 5 amalgam. So number 1, we're going to examine the prep and remember the size, shape, and depth of the prep. Clean the cavity prep with water and dry with air. If indicated, you can place a varnish, liner, or base layer at this time. Mix the amalgam according to manufacturer's directions and deposit it into an amalgam well. Pick up the amalgam in a carrier and dispense half of the load along the axial wall. Slide the carrier to the side as it is removed to prevent pulling the amalgam out of the cavity preparation. Condense the first increment into any retentive grooves while moving from distal to mesial using overlapping strokes. Next, we'll add the second increment to fill the cavity and condense against the walls of the cavity preparation. Condense against the walls at a 45-degree angle. We'll then add the final increment to overfill the cavity preparation and condense towards the margins. If the amalgam is not flush with the margin, it may break or chip when you're carving it. And then we want to burnish the amalgam by moving the burnisher over the cavo surface margins from the distal to the mesial. Avoid applying too much force while the amalgam is still soft. Use light pressure. Please watch these videos in the material and resources folder. Same here. Please watch this video in the materials and resources folder. So then criteria for a finished class 5 amalgam. The amalgam should be smooth with no detectable pits or voids. The occlusal gingival height of contour is reproduced. Mesiodistal contours are reproduced as well. Grooves, if present when adjacent to surfaces, are continued into the restoration. There are no open margins or submarginal areas present that cannot be corrected during finishing and polishing. And the amalgam does not extend beyond the cave of surface margins of the preparations. There's no flash. So next, let's talk about class 2 amalgam placements. So first, matrices when it comes to amalgam. So we talked about this a lot in, I believe, week 3. We're just going to cover a little bit more here. So a contoured and wedged matrix band is essential to prevent flat proximal contours, improper contacts, and overhang with our amalgam restorations. The most common material used today for an amalgam matrix is a thin stainless steel band on a Tafelmeyer retainer. And then you can review week 3's material regarding matrices, just to refresh yourself on the kind of the setup and what all the parts of a Tafelmeyer retainer do. This will be very important for your EFDA exam. When I took my EFDA exam, there was a big picture of a Tafelmeyer, and we kind of had to name all the parts of it. So you'll probably see this on your licensing exam. So it's always good to refresh that information. Armamentarium needed is pretty much the same that we talked about last week for class 1 or class 5 amalgams. You're going to want your basic setup of your mirror, explorer, and cotton pliers. You're going to want some methods of isolation, so either rubber dam or cotton rolls, dry angles, something to keep the area isolated. You'll want an amalgam well, an amalgam carrier, various sizes of amalgam condensers, some burnishers, where your options would be football, beaver tail, ball, or egg-shaped. Various carvers such as the Hollenbeck or clearoid discoid. Articulating paper. Plus, you will also need for a class 2 your matrix retainer and your matrix bands. You typically want a universal band for shallow preparations and extended bands for preparations that extend more gingivally. Then you'll also want crown and bridge scissors, wedges, any additional instruments you may want for condensing and carving the interproximal areas, and some floss so that when the filling's done, you can confirm that there is contact between the teeth. So for class 2 placement, it's pretty much the same as class 1 placement, except you need to concentrate a little bit more and ensure that the amalgam is inserted accurately and you're condensing enough so that way there's no voids, especially in that interproximal area. Carving is also more challenging with the addition of the marginal ridges and the proximal surfaces, that they need to be shaped to achieve the proper proximal and occlusal relationship. So that's just a little extra step compared to doing just a class 1 restoration. So next we're going to discuss the steps of placing a class 2 amalgam. First, we want to examine the prep and remember the size, shape, and depth of the prep. This will help us to determine if our final restoration is similar in looks, in appearance, in function as the original tooth was. Next, we're going to clean the cavity prep with water and dry it with air. If indicated, we're also going to place a varnish, liner, or base layer at this time as well. Next, we're going to apply the matrix band and wedge, and then we will mix the amalgam according to manufacturer's directions and deposit that amalgam into an amalgam well. We will then use the amalgam carrier to scoop up the amalgam out of the amalgam well, and then dispense half of the load of the amalgam carrier along the gingival wall of the preparation. Next, we'll condense forcefully and use overlapping strokes with a diamond end condenser perpendicular to the gingival wall. We're going to use vertical and lateral pressure and condense against the matrix band to ensure that the interproximal area is going to have a good contact. Next, we're going to continue to fill the proximal box by pressing the carrier against each increment to make sure it adheres to the previously condensed amalgam increments. Once the amalgam has reached the pulpal axial line angle, we're going to place the amalgam onto the pulpal portion of the restoration. We're going to use a large nib round condenser on the final increment to condense it at a right angle to the cuspal inclines. We're then going to burnish the surface in the same manner as we did with the class 1 restoration. We're going to begin forming occlusal grooves and fossae to give it some anatomy. Then we're going to use an explorer to carve the occlusal embrasure of the marginal ridge area before removing the matrix band. The area should appear rounded. And then next we're going to remove the band and the wedge. We'll then check for overhangs. We can use a Hollenbach to perfect the embrasure contours and cavo surfaces. We can also use a discoid cleoid carver to adjust the marginal ridge to the same height as its adjacent tooth. We don't want it to be higher, but we also don't want it to be a lot lower than the tooth beside it. We can then perfect the major grooves and pits and recreate the triangular grooves in the marginal fossae. We then want to check occlusion, make sure that's accurate, and then we can burnish the surface as well to give it that smooth, polished appearance. And then last, we want to check the contact with floss, make sure that we have a good contact there that kind of has some resistance when we pull down on the floss. So these videos are going to be available to watch in the materials and resources folder. You can look at the class 2 amalgam YouTube videos for the following few videos. Next, we're going to discuss finishing and polishing amalgams. Alright, so a properly contoured and polished surface on a restoration is going to not only benefit amalgams, but also composite restorations. One, it's going to contribute to the longevity of the restoration, how long it's going to last in the patient's mouth, but it's also going to contribute to the health of the surrounding gum tissues and periodontium. So, important to note, finishing and polishing should not be done on an amalgam restoration until it's reached its final set time, which is usually 24 to 48 hours after it's been placed. So this is not something that we can do on the initial day of the appointment when we're placing the amalgam. It's something that the patient is either going to have to come back for just to finish and polish the filling, or else it can be done at a future already scheduled appointment like a hygiene recare appointment. This is due to the fact that polishing and finishing prematurely can actually weaken the restoration. So we want to avoid doing that. We want to let it set in its natural state without disrupting it at all. That way it's not going to cause the filling to fail down the road. And there are some slight differences between finishing and polishing. So finishing involves removing marginal irregularities, defining anatomical contours, and smoothing the surface roughness. It's more so defining the anatomy, whereas polishing is going to obtain a really smooth and shiny surface on the amalgam, so that way plaque isn't attracted to it and you can keep it clean a little bit easier. So what are some advantages of finishing and polishing? One, it can help reduce plaque accumulation, which also reduces the probability of recurrent decay, and it also assists in the maintenance of periodontal health. Two, it can prevent the amalgam from deteriorating prematurely, so it can help prevent corrosion and tarnish of the amalgam filling. Three, it gives the opportunity to correct discrepancies in the anatomical contours of the restoration. So if you don't like the way the filling looked after you initially placed it, you can always go back in and adjust the anatomy a little bit more with the handpiece. And then finally, you can also prevent potential occlusal complications down the road by adjusting the bite. Some special considerations to keep in mind: creating too much heat while polishing is potentially detrimental to both the amalgam and the pulpal tissues within the tooth. Heat brings mercury to the surface, which leaves a dull surface. It is important to use abrasive agents in the order of decreasing coarseness, finishing with the least abrasive material. It's kind of like sandpaper, so if you start with a really large grit sandpaper and then end with a finer grit, you're going to get a smoother polish. On the other hand, if you start with the finer grit and then keep going up in grit size, it's going to just look like a scratch surface, and that's going to attract a lot of plaque and bacteria. That is not what we want. So what is the proper sequence for finishing and polishing? First, we want to adjust the occlusion before doing any finishing and polishing. We have to have the occlusion right before we can start making things look pretty. Next, we want to use rotary instruments. So we can use stones for bulk reduction. We can use amalgam finishing burrs, which leave the surface finer and smoother. We can also use finishing discs, which will help recontour and finish the amalgam filling. Next, we can use some hand instruments like a knife or file to remove excess amalgam. This is especially helpful interproximally. We can also use pumice or tin oxide, which are polishing agents that are used with rubber cups, similar to a Profi, it almost is abrasive to the surface and polishes it that way. We can also use sandpaper strips, which help smooth the interproximal areas. You can watch this video along with any other videos from this week in the materials and resources section of your Blackboard folder. So next, we're going to discuss evaluation criteria and factors that cause failure or success in amalgam restorations. Number 1, the amalgam should be smooth with no detectable pits or voids. The triangular ridges of each cusp should extend into the central groove. Fossa should be the correct size and depth in the correct location. Major grooves should be distinct and in the correct location as well. Supplemental grooves that are in adjacent enamel should extend into the restoration. No open margins or submarginal areas that cannot be smoothed during finishing and polishing. The amalgam should not extend beyond the cable surface margin of the restoration. In other words, no flash is present. And the restoration should occlude with the opposing teeth simultaneously with the uninvolved teeth. So we want to make sure that the restoration isn't hitting the opposing tooth too soon. This could cause a lot of issues in the future down the road, especially TMJ issues if the occlusion is not correct. The restoration should not be out of occlusion though. If it's out of occlusion, that can cause issues as well. The tooth can start to drift to try to find occlusion with another tooth. The marks from the articulating paper should be of equal density on both the restoration and surrounding tooth structure. So we don't want any marks to be darker on the filling, but we also don't want them to be a lot lighter on the filling either. We want them to be pretty similar in density as the filling tooth and any adjacent teeth. The patient should also state that the occlusion feels fine. This is sometimes difficult if the patient is numb, but a lot of the times they should have a good feel even on the other side of their mouth where it's not numb if the filling is too high and it's affecting their bite overall. The marginal ridge should be rounded to form an occlusal embrasure, and the proximal contour should be convex facial-lingually. Occlusal gingivally, the contact area should be convex from the marginal ridge throughout the contact area. The lingual embrasure is slightly larger than the facial embrasure, and the contact catches or offers resistance when flossed. You don't want to just drop the floss down and there's no resistance at all. We want some resistance so food's not getting trapped in there. And then lastly, we'll talk about some causes of amalgam failures. So amalgams can fail due to wear that affects marginal integrity from leakage. So if the person is grinding and clenching a lot and it's causing wear around the edges of the amalgam, it can allow leakage to get into it and then cause recurrent decay. There can also be inadequate condensing, leading to corrosion, decreased strength, and even fractures. We want to make sure when we're placing amalgam, we are really condensing them hard into that preparation. That way we don't have any of these issues. Creep can also cause amalgam failures. This is the prolonged exposure to stress. And a faulty cavity prep design can also lead to fractures. Just the way that the dentist designed the prep, if there's an undercut somewhere or something along those lines, the tooth is more susceptible to fracture in those areas. Thanks, guys.